Our goal today is to present facts known so far about the coronavirus and discuss suggestions made by the Centers for Disease Control and Prevention and the World Health Organization on recognition, transmission, and prevention of the disease. What is COVID-19? There are multiple strains of coronavirus, but you've been hearing about coronavirus disease 2019, also known as COVID-19. The coronavirus is known to cause a variety of respiratory illnesses in humans and can become dangerous or even deadly to certain individuals. Typically, people affected most are the same demographics as those affected by the flu, the young and the elderly. Your responsibility is to be aware of the facts of the illness and do your part in preventing its spread. According to the CDC and World Health Organization, common symptoms of COVID-19 are fever, tiredness, dry cough, and shortness of breath. Other symptoms can include aches and pains, congestion, runny nose, and sore throat. COVID-19 is thought to be most contagious when a carrier is exhibiting symptoms, but the incubation period can range anywhere from 2 to 14 days. That means symptoms may not manifest right away, which can be dangerous in spreading the sickness. COVID-19 passes from person to person through small respiratory droplets. These originate from a carrier's nose or mouth when they cough, sneeze, or exhale. When these droplets land on another person, or a surface where another person can come into contact with them, they can infect others. It's important to note this doesn't necessarily mean the illness is airborne. Respiratory droplets seem to be necessary in the transmission of COVID-19. However, it is still easily spreadable by touch. Currently, there is no vaccine or sure way to avoid COVID-19. The CDC and World Health Organization suggest the following to help reduce chances of being infected or spreading the illness. The health etiquette of coronavirus is much like that of the flu. You should wash your hands frequently and carefully for at least 20 seconds, especially after using the bathroom, being in contact with others, or coughing or sneezing. Use hand sanitizer if you cannot wash your hands immediately. Be sure to cover coughs or sneezes and disinfect any surfaces. Avoid touching your mouth, nose, and eyes. Do your best to avoid contact with sick individuals, and if you feel unwell, stay home unless seeking medical attention. There's been some confusion surrounding the use of face masks with COVID-19. Here's what the CDC wants you to know. You should not wear a mask if you are well and an otherwise healthy individual. Masks should be utilized by those showing symptoms of the illness, healthcare professionals, and those providing care to sick individuals at home. People buying and hoarding face masks have created a shortage for those who need them, so take care to only use as needed. The danger you face as a truck driver is interaction with other people. The CDC says travel is a potent force in the emergence of disease. So, at rest stops, on deliveries, and during everyday interactions, you must be vigilant in your hand hygiene, conscious of your sneezing and coughing etiquette, and if you are sick, it's crucial you don't work through it. Do your part to stop the transmission of COVID-19. In closing, the best thing you can do for yourself and others is help prevent the spread of COVID-19 by following the suggestions set forth by government agencies. Be on the lookout for any updates on the illness, and in the meantime, don't forget to wash your hands frequently.